Fortunate that government did not take note of that immediately, but instead, what the government did was to reorganize the incident management system on two different occasions. I think even on the third occasion, it was reorganized, removing the head, who is Dr. Fala, from the incident management system. So no reason were given for his removal from the incident management system. What role was he playing then? We continue to question that. That did not give any answer to the public and to the scientific community. So at this late time, when everything that we have been talking about, particularly the wrong diagnosis that was being carried out to lead to his removal, I think is now unfortunate. The composition of the committee itself is welcome, but I call for the reconstitution of that committee. Back in April, I had advised that the government set up an independent scientific panel that would delve and probe into the lapses that were occurring at the National Public Health Institute, particularly with respect to the pandemic response, the wrong testing, particularly at a time, the testing of unnecessary and unscientific testing of dead bodies, which was increasing Liberia's case fatality rate. As you will note, Liberia had a case fatality rate of up to about 10 or 11%. And it's reconnecting.
We hope that it will. Also, you back. That will be you are reconnected now.
Okay, it's reconnected. So we have hoped that they would have formed the committee that time. And as I indicated, I did call for the setting up of an independent scientific panel to probe into those issues with which the COVID-19 response was faced. And that was not done. The formulation of this committee is welcome, but I will call on the president to reconstitute this committee in order to have it including, as I understand, the LMDA, which is the Liberia Medical Dental Association, is heading it. So that includes a medical body. It should also include.
As well.
Say that again.
The CDC and WHO are also involved in they are part of the committee.
The committee should include diagnostic scientific experts. It should include epidemiologists. And these people should come from the country, Liberia. Liberia has enough competent diagnostic expertise, scientists in epidemiology and infectious disease response in a country, particularly outside of the country. Such a committee should be independent. It should exclude for now people who are part of an international organization. I understand the WHO. I understand the WHO is part of that committee, but the WHO representative is one person who represents the WHO to guide such a response. And so during the course of all of these lapses, what were the advice given from the CDC representative and the WHO representative? The wrong diagnosis, the false positive results, mixed results that were given to patients, the importation of an untested COVID-19 drink into the country, when the WHO itself, and remember, I was on air several times advising the government not to import this drink. All of these things need to be answered during this particular period. So what was the advice given? I believe the WHO representative and the CDC representative did advise, so we will need to hear their side, or we will need to, such a committee will find out if the government did listen to them. So these two entities should not be part of that particular committee.
You also spoke about opposing the Ministry of Justice being on that committee.
I also indicated that the Justice Ministry should not be on that committee. We have enough criminal situation in the country that the Justice Minister and the Justice Ministry should handle. Currently, if you will look, the rape cases have increased, if not tenfold or 24. I don't have the exact statistics in front of me, but I think the statistics show that there's a high increase in rape cases in the country that have not been investigated. Those are things that should concern the Justice Minister, the Justice Ministry now. That is an eminent issue that needs to be addressed. Our sisters, our daughters and mothers are being molested. And that has increased during the course of this COVID time. We need to have answers to those. And so taking the Justice Minister and putting him on a committee to discuss or to probe scientific issue is a misplacement of his expertise. He has high expertise. That expertise should be used appropriately. There was a recent violence when the other parties went to Grand Jide. That violence needs to be probed. I understand there was a committee set up, and we hope these committees bring back good resolutions so that we don't have these issues occurring, so that we have the situation of rape taken care of, at least during this time period under President Weah. The Foreign Ministry was included on this committee to probe the lapses and the problems at the National Public Health Institute. I think the Foreign Ministry needs to concentrate on rebranding the image of the government in the international community and in the region. Quite frankly speaking, we have a very bad international image. Those who praise the president every time may not know it, but those of us who are in the international community definitely know that. In a scientific community, political, diplomatic community, our country's image has gone down bad because of some of the policies that have been implemented, the scandals, the other corrupt practices, which are giving our country a very bad image. And so the Foreign Ministry needs to take care of that, needs to rebrand Liberia's foreign policy, Liberia's foreign approach, if Liberia has one in this government. So these are people that should be excluded. If this is a very important committee, and I hope those who are advising the president are listening, and I hope the president himself is listening. This is a very important committee. This has to do with the health of our people. We need to come together in order to address this problem. Somebody cannot be negative and you tell them they are positive. One person cannot sign a document as negative, like in the case of Professor Alaric Tokpa, where his results were given to him as negative, signed by the director, Dr. Fowler, and on his way home, he was called and given a verbal positive result, and texted and given a positive result in the text. These contradictory results are not showing our response and the National Public Health Institute to be in a very good book with the scientific community internationally. And so these are issues that need to be addressed very, very critically, very scientifically, and sincerely from an independent standpoint, so that the results and the solutions that will be provided will be the solutions that will help to curb the situation and bring back the dignity that our entities should have in mounting this response. Otherwise, it will be just a mere political pronouncement, political investigation, as we have been seeing. You can already see the misplacement of different group of people, 4 persons that I have named now, or 4 entities that should not be on that committee. And at the end result, it will be seen as another cover-up. We need to get at the bottom of what happened at the National Public Health Institute with regard to this response. The international community and partners have spent a lot of money on Liberia. They are giving a lot of donations to the pandemic response. And where have all those monies gone? We've got $30 million loan. How has that money been spent? I have provided suggestions as to what could have been done with that money. For example, taking some of that money and putting it into one of these companies, investing it into one of these companies that are producing the vaccines. We have several vaccine producing companies now that are in trial, in late stage 3 trials. So we could have invested some of that money so that when we have a very good candidate vaccine being approved, we can get it at a cheaper rate or at an affordable rate. So that is my take on the whole question of this committee that has been formed. That committee needs to be revamped. It needs to include independent-minded thinking people and exclude those entities that I have named: the Justice Ministry, the Foreign Ministry, the WHO representative, the CDC representative. Those 2 that I just named lately have to tell the Liberian people how they have been guiding the process of this pandemic response and how they have been guiding the health system as a whole. It's been, 4-5 years since Ebola. Where is the Ebola experience that we had? We need to be the go-to country. Countries should be running up to us. As an example, look at Madame Salif. The world stage is calling on her because of the way she led the Ebola outbreak. There were problems in the initial stages, but she caught on, revamped all of the structures, and with Tauba Newswa at the head of it, pushing with other experts, other expertise, they were able to mount a response. Those of us were out here in the international community and also created structures. I testify at Congress on behalf of the Ebola-affected countries and put forth a roadmap as to how the Ebola epidemic should be brought to an end. Congress accepted those propositions, the proposals, and that's how, in line with Madam Salif's call for help, thousands of soldiers were sent to Liberia. Logistics were sent to Liberia. Hello? Hello?
Are you there? Okay. There's this report from the General Administrator of John F. Kennedy Medical Hospital, Dr. Gerald Brown, when he said recently that there's cases of coronavirus reducing in our country in Liberia, so the cases are not going on high. What do you make of that information coming from Dr. Gerald Brown? He's one of those fighting the disease here.
Dr. Brown has good expertise from our fight against Ebola. One problem that I see is the lack of the requisite equipment, tools, and medications. Well, presently, no medications to fight back the coronavirus in Liberia. The Liberian cases have been going up comparatively. If you compare the cases we had back in March, April, May, you will see that we were at, it's reconnecting again. It's reconnecting.
On Power TV. Now we have Dr. Nyan back on the air. Back, you have been reconnected.
Okay. We had around March, we had about the early part of March, we had just 3 cases. It went up to 30, 37, and I indicated at the time that once we start testing rigorously, we will have an increase, a drastic increase exponentially in the cases that we had at the time, because we were just at 10 cases, 3 cases, and there was nothing happening. There was no information. It was simply because there was a lack of testing reagents and chemicals. So when you are not testing, you don't see. The virus is transmitted by large asymptomatically. That has been scientifically confirmed now, that asymptomatic carriers do transmit the virus. And so the virus transmitted throughout the community asymptomatically. So we have a lot of transmission in the community. But because Liberia does not have enough testing kits, and the testing that have been done are wrong, as the results have been shown now, for which there is an investigation lately in this day, that is why we are under the false impression, the deceptive impression that the cases are going down. But we are not testing as much as other countries around us in the region are testing. Did you say false impression? Yes, I said false impression, F-A-L-S-E, false impression, deceptive impression that our cases are low and they are going down. Why are you referring to that? It's simply because we are not testing more. The more we test, the more we will find. The cases are there. They are pervasive. The virus is very pervasive in its transmission by silent asymptomatic carriers. And we have a lot of that in our communities. But because we lack mass testing, now this is the problem. We don't have a process of mass testing. Our testing capacity is low. Our testing ability is low. We don't have enough testing kits, and they can confirm that. We don't have enough testing reagents. Even the reagents we have, you have to question the validity of those reagents. Some of the reagents have not been validated. These rapid diagnostic tests, most of them have not been validated by regulatory agencies. So which kits are we using? What is their accuracy? All of these questions are the scientific questions that need to be answered. This is not a political issue. It's purely science, medicine, and human life that is involved. So we must take it seriously. Although political decisions are the ones that are now running it, which is very important in providing us these things that we need. And that is why I was saying that we are under the false impression that the cases are going down and that we are doing well. But I don't think we are doing well. If we were testing as much as other countries are testing, you will see our cases will be up in the 2,000s, 3,000s.
Okay, Doc, let me ask you this question. Recently there has been a lot of controversy surrounding COVID-19 fight in our country. Recently, we received reports in Liberia that our Vice President, Taylor, has been tested positive of the virus, COVID-19, owing to the fact that a letter or communication was released to the public with the signature of the Minister of Health that with the Jara attesting that the Vice President is being tested. Since then, it's been 3 days now. We haven't heard from the government to release a statement. But what do you make of all of these things in terms of confidentiality, and what's going on in our country lately?
Since the beginning of this pandemic response, much of what I have been talking about also have been the ethics surrounding, the medical ethics surrounding response and treatment of patients. Confidentiality is one key issue. We did discuss that on other networks earlier on during the course of this pandemic in March and April, as well as May. It is unfortunate that the medical records of our Vice President were leaked out in the manner in which they were unofficially. I think this is one of the reasons why you cannot have the Ministry of Health on that committee, if that committee to probe this process of the lapses also incorporates the Ministry of Health. I don't know if it is the minister herself, but the ministry, I'm talking about the institution, because these are the questions that need to be answered. The confidentiality surrounding patients' data, all of that has been a problem at the National Public Health Reference Lab and the National Public Health Institute, which is housed by the Ministry of Health. So the Minister of Health herself needs to answer questions to this committee, for which she should not be on that committee. And my heart and our prayers go out to the Vice President. We pray that she recovers. Our hearts and prayers go out to those who passed away recently as well. Recently, I named Representative Nangwe Slaw and Representative Muna Youngblood, Muna Pelham Youngblood. May their souls rest in peace. Our colleague and comrade, Dr. Thomas J., passed away recently too. All of those situations signal the lack of a good healthcare system in our country, that we have to fly out officials all of the time. We flew out the Vice President recently. According to the documents that were leaked, she tested for COVID-19. What happens to the rest of the COVID-19 patients that are in the country? And I spoke about the discrimination in performance of healthcare and the COVID-19 response. It has, come to confirm exactly what I was saying. This is about the 3rd or 4th time, if I'm correct, that an official has been flown out of the country because of COVID-19 infection, which is SARS-CoV-2 infection, which causes COVID-19 disease. So what happens to the rest of the COVID-19, quote-unquote, COVID-19 infected patients that are in the treatment center? Will they be flown out as well? These are questions that we need to be answered. If this continues, it's going to bring disrepute to the government and the health system. Also, if this discriminatory practice continues, it is going to undermine the response efforts themselves. As a result, the citizens may not adhere to regulations that government may be promulgating, which we try hard during the 15 or more awareness series that I have over all of your radios. Citizens will be very lax. They will not adhere to these regulations because they have been treated differently as opposed to how government officials have been treated. And so I would think that the solution is that government should give a good portion of the budget to healthcare. Now, if you look at the recent budget, that brings us to the recent budget that has been submitted for review. You have the Ministry of Finance, if I saw those numbers correctly and I stand corrected, having 90 plus or 90.1 or so million dollars. Jackson F. Doe Hospital has about 6.1 or so million dollars. I mean, look at that disparity. I don't even know what they have. I didn't go through the entire budget, but I'm just giving that one example. The EPS has 7.1 million 1.0 million more than a hospital that should be treating EPS personnel if they fall sick. This is a misplacement of priorities. I think that budget needs to be scrutinized, and I will call on our legislature, those in the House of Representatives and those in the Senate, to scrutinize that budget and switch those numbers around. Healthcare should have $100 million to start with, and the Ministry of Finance should have $10 million. What is the Ministry of Finance doing with $90 million? We are talking about the lack of PPEs. We are talking about the lack of diagnostic kits. I have suggested that I could come in with my team to help produce our country's diagnostic kits. Nobody gave attention to that. I could come in with a team of scientists. We have a lot of Liberians here who have expertise in mounting infectious disease response. The young man who mounted the last Ebola response is right in the country here. He's with Johns Hopkins University. The world is using his expertise in contact tracing. I'm talking about Dougbeh Chris. He's one of the lead scientists around here whose expertise is being utilized. So why our country not utilizing him? All of this boggles our mind. So I would suggest to our legislature to re-scrutinize that budget and change those numbers around. Make the suggestion that the numbers should be placed appropriately to where they should be placed.
Let me ask you this final question. You talking about coming back to your country to contribute to the fight against COVID-19. But how prepared are you to make such sacrifice?
Since January, when I first elected the government and provided a skeletal roadmap as to how we should begin the response, given our experience already with the Ebola outbreak, I followed that with a communication saying that the virus will be coming into Africa. It will be transmitted, we kind of postulated that it will be transmitted cross-border and cross-continental. That came to pass. Since that time, I have not heard from the government. And if you've listened to my presentations on the radio, my interviews, we have said that over and over. One of the main times this question was brought about was on Spoon FM and TV with Mr. Witherspoon. We discussed that extensively. We are prepared any day, any time with the expertise that we have and the manpower expertise that we have to have come into the country to do what we need to do in terms of developing the diagnostic case for the country, setting up additional diagnostic laboratories in addition to the National Public Health Reference Lab, training additional manpower. John Dougbeh, who is the head of the National Public Health Reference Lab, is a very experienced laboratory personnel. It's reconnecting.
Reconnection. Okay. You're live now, Doc.
Okay. John Dougbeh, who is the head of the National Public Health Reference Lab, is very experienced. I have carried out workshops. It's reconnecting.
Reconnection is the internet system.
Okay, I think we are back. Yes. So I carried out workshop when I was in the country. We have some experience and very smart diagnostic personnel in the country. We have our own Liberian institutions like Africa Bio and one or two other institutions that are versed in this area. And so this is the question that goes back to the government, which I think all of you journalists now need to ask the government. Why have they not invited their expertise that is in the diaspora? It's reconnecting again. Hello? It's still reconnecting. Okay, we are back.
Chris Nyan is based in the United States. Okay, you have connected that.
Yes, we're back. So the question should fall back to the government of Liberia as to why has it not invited all of the goodwill and its expertise that have volunteered to come into the country to help with the response. From this day on, and I know some journalists have been asking this question, it's reconnecting again.
Oh, gosh.
Okay, we're back again.
That?
Yeah, we're back again.
Yeah, that?
Yes.
Hello?
Hello?
We are back. We want for you. Hello? We just want for you to hold on and we go to the telephone line where the public will participate. Can you hold on?
Yes, but just to end my statement, the question should go back to the government as of this point. Since we are having this investigation, this should be one of the investigation questions. Why have you not invited your expertise that is out of the country that have volunteered to come to help with the response? This is one of the questions the government needs to answer. And I think all journalists from this day on should pose this question to the government.
Okay, thank you. You are watching Power9 on Power TV. You have also a special studio guest who is live from the United States of America. That Liberia medical scientist, Dr. Dougbeh Chris Nyan, is live with us online. You can now participate by calling 0880-511-113. 0880-511-113. And you can also call us on our orange number 0776-761517. Maybe you have a question, you want to make a statement, you can go ahead. 0776-761517. 0880-511-113. 0880-511-113. You may have a concern what Dr. Nyan is saying, and you want certain clarity, certain information that has to do with COVID-19 epidemic. He's standing by to listen to you and give you a response. So you can call 0880-511-113. And you can call yours. Yes, 0776-761517. And so while we're waiting, the caller, let me ask this question. Dr. Nyan, do you think the fight against COVID-19 our country is being politicized, like many, have harbored such belief?
The elements and the conduct and the characteristics of how the COVID-19 response has been mounted gives the impression that it is being politicized. There are several instances that you can count on. And number one, the revamping or reorganization of the incident management system with the removal of the director of the National Public Health Institute, who has the knowledge and trained expertise to head this response, and his replacement with political appointees that have no expertise and no medical background to head this response can be seen as political. They setting aside or sidelining of 3,000 already trained Ebola, during the Ebola time, 3,000 trained public health personnel who are capable of mounting the response in terms of contact tracing, epidemiological data processing, and active case finding. Their replacement with Okay, their replacement with, yeah, okay, their replacement with quote unquote 6,000 recruited and trained contact tracer by the Monrovia City Corporation, which is not a medical entity, is political. The decision to get or source $30 million and not giving a single portion, again, I stand corrected, a good portion of that $30 million to the response efforts, instead utilizing it to carry out feeding when we are not in a hunger situation at the moment. We are not, the country is not starving at the moment. We are faced with a pandemic, a medical problem. Instead, that money is being used for sparse distribution of food, which is being questioned as to what population is this food reaching, who is targeted. I mean, this whole process of the political decision making, and all of these decisions are political. They're not been scientifically made. So you can see the political nature of all of what is going on. These are all policies. And now when we say political, please don't take it the other way, because as soon as people hear political, you know, it's sort of ignite fire in them. But these are policy decisions. That's why we are saying political. And these policy decisions are not appropriate.
Time is running against us. Time is not in your favor. Can you give your party comments? I should take leave on you on this program.
Well, I will encourage the citizens within our borders and parts of the world that are tuning into this. This pandemic is, as we call a pandemic, this disease is global. I will admonish all to continue to adhere to the public health regulations in your various jurisdictions. Wear your masks.
Somebody want to participate again? We are squeezing this person. Hello? Yeah, what's the name? Go ahead, you come from Bombing County. Let's hear it. Hello? Are you still? Yeah, you're live on the program. Go ahead. Yeah, I want to say good afternoon to that. Yeah, my question is that I want to know from that because we believe that the coronavirus is here, but I really want to find out from that how many days they take when they examine the check. We want to know how many days take before the results come up. Can you repeat your question? How many days? Dan, you understand what you said?
Yes, I just had it down here. Yes, the question is, how many days does it take for results to come out? There are two different type of tests being used around the world. Tests that we call rapid tests, and the test which is serological. Don't mind all the terminologies, okay? The rapid test is S, serological. The other test is molecular test, M. Just take it for that. Issue under normal circumstances with a rapid test take not longer than 1 hour. A rapid test, it should take no longer than 1 hour. Some of the rapid tests take about 15 minutes to get your response. The molecular tests, some of which we have, will take about maybe 3 hours to run, and you can get your result even the same day if the system is efficient, if that testing system is efficient. And these are some of the problems we have. So that's how long it should take if this is the kind of test being used and if the system is efficient. Why is it that tests are taking 3 days, 4 days, 1 week before the patients get their result are some of the questions that we need to delve into with this current crisis and this current committee that has been set up. And again, that committee should include the requisite expertise that are named, and it should exclude those that we talked about earlier.
Okay, so you are on your parting comment before the caller Kevin is concerned.
Okay, so yeah, I will admonish our citizens and citizens around the world to wear your masks. It has been proven that the mask serves a purpose. Wear your mask, keep your social distance. I always say maintain 7 feet or more distance from people, although we say 6, but maintain 7 feet or more. Wash your hands constantly with soap, at least for a minute. Sanitize your hands with those hand sanitizers that we have that has the alcohol of about 65% or more alcohol content. When you are coughing, please, because you don't know whether you have the virus or not, cough in the inner angle of your air bowl. For those of you looking at me on the Facebook, in the inner angle of your air bowl, cough in the inner angle of your air bowl, sneeze in the inner angle of your air bowl. Again, I will depart by calling on the government to reconstitute the committee to probe the problems at the National Public Health Institute regarding the wrong diagnosis, the false or positive results, sometimes false negative results probably, that it should include people of scientific experience and expertise. It should exclude the Justice Ministry. It should exclude the Foreign Ministry. It should exclude the WHO representative. It should also exclude the CDC representative. We have enough Liberian expertise and people of ethical standards that can become the manpower of that independent committee. And we are not short of that. So to make this committee really what it needs to be, it should be constituted in that fashion so that the decisions from there can be respected by our people. We saw how the $25 million, the $25 million which was supposed to be used to mop out the investigation. We saw how it went. We saw how the $16 billion investigation went. And we don't want, and this is an advice for the government, we don't want the community to come back and say that's the same thing they are doing again. So depart from that. Now go forward and make a change. Thank you very much. I say my greetings to everyone, and please adhere to the health regulations.
Thank you very much, Dr. Chris Nyan, for joining us on Power9, on Power TV this afternoon in Monrovia, Liberia.
Thank you very much. I appreciate it.
Thank you very much. Thank you very much.
Thank you very much for listening. We had a lot of technical difficulties on the side of the studio, but hope that the discussions were worth your while, and we look forward to speaking to the public on other specific matters. Continue to wear your masks, continue to observe all of the other health regulations, which include keeping your distance, washing your hands, sanitizing your hands, and staying in place as well. This is very important. These regulations, together with the help of medications that have now been proven to be effective, like remdesivir, being used in the treatment centers, will help all of us curb this particular pandemic. Fortunately, there are vaccine candidates that are promising from various investigators and various companies That includes the Oxford vaccine that has been tried around the world and in South Africa. That includes the vaccine by Johnson & Johnson. That includes the vaccine, and vaccine candidates. Let me make that correction. Vaccine candidates by Novavax, the vaccine candidate in China, and many others that we may not know about at the moment. Hopefully, within the next 12 months, and it is not coming anytime soon, it's not coming in 3 months, within the next, say, 6, 7 to 12 months, we will have an approved vaccine by the US FDA and other regulatory bodies around the world. God bless you, and you have a wonderful weekend.